Hi there, Friday, February 26th. I'm J.R. Lewis with your daily briefing here today, and it's not going to be especially brief. We have two folks to talk about. First off, Mayor Koplin regarding the fact that this latest outbreak involves somebody that is an employee of the city. So we'll touch on that some, and he'll provide his reaction to that. And then we'll talk to Dr. Sanders to try to clarify what close contacts of someone who's positive need to do, what contact quarantine is, what travel quarantine is, what's coming up next in Cordova's management of this outbreak, some extra testing and the next vaccination clinic, that kind of thing. These briefings, again, come to you on the radio at 1, 5, and 8 p.m., and then they go to our archive for our talk shows and briefings and a lot of our content of this type. YouTube.com/Cordova TV. Again, YouTube.com/Cordova TV for the online listening opportunity. So we'll start out here by speaking to the mayor on our briefing for the 26th. Mayor Koplin, good to be able to hear from you in challenging times, of course. What is it that, from your mayor's seat, you would like the community to know about this, this latest challenging situation here, I guess, with this outbreak?
Yeah, well, thank you, J.R. And I think it's important for the city to be transparent and to answer questions. Again, we've through the entire course of this pandemic, starting clear back in February and March of last year, partial information or rumors get circulated, and those can be a lot more damaging than just the basic facts, even if those facts aren't necessarily good. So we do have an outbreak that unfortunately was a travel-related incident. It did involve a official of the city of Cordova, and it just brings to mind some basically responsibilities and to each other and the nature again of this virus, which is so difficult to identify and can expand so rapidly with just fairly minimal contact. So.
Okay, well, what are some of the questions that have come your way that that we know enough about, I guess, to be able to, in the interest of that transparency, again, to be able to communicate to folks?
Well, I think Cordova Times did a great job. They just released an article today, and you can search for that and pull it up online and read it. And I just want to commend Chief of Police Nate Taylor. He interviewed with Zachary Snowden over at the Cordova Times and just laid out the timelines and what happened. Basically, the chief was on some travel, came back to the community, had some contact with others in the community, later tested positive, and that started a spread event through the community. And so the city manager, myself, council, have been getting a lot of questions about, there's a lot of rumors on Facebook. Were the police involved? What's going to happen? And so forth. I don't want to get into the details of the city's plan and how employees, the consequences, I guess, what the elements of those plan are and what the consequences of not following it are, and if that even happened. That's really the general manager's purvey, and I know she's doing her own investigation and will proceed accordingly. But just in terms of the basic sequence of events, that's it. We did have a chief of police traveled, came back. I've had some contact with wrestling team, later tested positive, and that resulted in fairly rapid spread. We went from 0 cases at the beginning of the week to 19 active last I checked earlier today.
Okay. Well, that's interesting about the article. I hadn't heard about that, but I definitely will want to take a look at it and see. We had a chance to collaborate with Zachary the first time on the candidate forum there recently, so I've enjoyed interacting with him. So anything else now on this situation, or is it best really to just defer to what's been written at this point?
Well, no, I think the other thing that needs to be communicated to the public is that the city takes this very seriously. They're again reiterating those policies internally to all the city employees. They've also extended that through the emergency system to businesses, making sure that everyone's aware that we do have somewhat of an outbreak in effect, and we've seen a lot of businesses in the school district are already responded in response. But we do encourage. We like to remind the citizens also that more and more of the population is eligible for vaccinations. Our Lonka Health Clinic, our Cordova Community Medical Center, Dr. Sanders have all done a fantastic job. I've heard nothing but good about the efficiency and organization of the vaccination process. We have over 700 now that have been vaccinated with the first dose and over 300 with the second dose. That is probably currently our most effective tool. So the city encourages people to consider the vaccination to help to get through this pandemic. And just a reminder, it's an invisible, freely traveling virus, and even though you're asymptomatic, you can be spreading it without their knowledge. So that's what happened in this case, and why we have those medical response teams recommendations and the local mask mandate in place. So we really get frustrated as a community when we have these avoidable type outbreaks, and just remind the community to continue to be vigilant, and the city is going to do their part, and you'll see that reflected in the facilities management and the reinforcement of the rules with city employees.
Yeah. Well, I mean, obviously, it's frustrating for the community to anytime, particularly, I should say, for any community, when a central figure in enforcement or in having some sort of official role in the response ends up in a situation like that. So obviously, that's going to generate questions. You talked about the sneakiness of the disease, and you actually had an experience. I mean, you can speak from experience trying to deal with this.
Yeah, and I have to say I'm empathetic to anybody who's contracted the virus, and I had a situation where I needed to do some travel for some maintenance. It was very quick, less than 48 hours. It was after things had kind of calmed down. I took exceptional precautions, wearing masks. I stayed with a friend actually in Anchorage, specifically to minimize contact at a hotel or commercial lodging. Large house, separate floors, separate rooms. Wore masks inside their home, sanitized on the way in and out. And the very few businesses I limited myself to, again, masking, sanitizing on the way in and the way out. A person did become symptomatic in the home I was staying at, but I was following such tight protocols. I really expected that I wouldn't test positive, but I took exceptional precautions. That's just it's what the whole community has done all along, and I feel like as a public official, I certainly don't want to be one that helps introduce it to the community. So you just take precautionary steps. I stayed in a guest room, used my own bathroom for several days, and as a result, didn't spread it to my own family or to the community. But no one was more shocked than me when I tested positive, and it was a little mind-boggling actually. So.
Wow.
I guess my takeaway was not that those protective measures aren't effective. It's just that even with all those protective measures, you can still contract this virus. Yeah. And once you have it, and until start showing symptoms, you can shed it for 2 days, and that can wreak a lot of havoc in a small town if you're, not limiting your activities and contacts. So, on the one hand, I'm empathetic to those who have caught it, and it's somewhat of a surprise, but we know that this is a tricky virus, and I just want to underscore how important it is to follow those protocols and
particularly as readily available as the information is. So, well, anything else to leave us with going into the weekend?
No, just again, I'm disappointed that this did involve a city employee, particularly around the police department, who had such a positive win here a couple weeks ago in their, in their battle against drugs, and they've served our community very well, and it's unfortunate that that there's a black eye like this at this point, but It is what it is, and it's happened. So we need to do our diligence. We are doing that as a city, and encourage the community to do the same. And I expect that our case counts will drop as a result, and we can get back to normal and better as we get more vaccinations here.
All righty. Well, thank you for the time, Mayor, and we hope you have a good and safe weekend.
Yep, you too. Thank you very much for helping us communicate to the community.
Now we'll switch gears from the city side of things back to the medical side and visit with Dr. Sanders here. Doctor, good to be visiting with you again. Always, challenging circumstances, of course, but good in the sense that you're great at providing context and understanding for these challenging times. And when you and I talked this morning, we talked about sort of defining some terms so people are clear when they hear these terms, what they mean, especially as regards context in Cordova. And one of those things is what is a contact? How is somebody defined as a contact of a person who's been deemed to be positive?
Yeah, great. Thanks. We've been getting a lot of questions, and I appreciate the opportunity to get to provide some guidance to the community. So first off, when we're identifying contacts, we go through an interview with the individuals that test positive. Of course, our information is only as good as the information that we're provided. But when we go through that interview, we're trying to identify any individuals that have been within 6 feet for a cumulative time of 15 minutes. And we go back either 2 days from the time of the test for an asymptomatic individual, or for a symptomatic individual, we go back sometimes much further, depending on when their symptoms started. So once somebody's been identified as a contact, then we ask that they do what's called the contact quarantine. So if you are a close contact to a confirmed case, you're asked to quarantine. Quarantine is a term that is only used with the people associated with a positive contact. We ask people to stay home all the time and keep away from household members as much as possible when they're at close contact quarantine. The preferred period for quarantine at the very beginning of COVID was 14 days. That 14-day is still the preferred period. However, the CDC has decreased those days in hopes to be able to increase compliance. So the current required period is 10 days. Mm-hmm. Individuals should really monitor for symptoms for the full 14-day period, but are asked to stay home and isolate as best they can from household members for the full 10 days.
Okay, and the reason being, I would expect that if one of those close contacts ends up being another positive case and they've been around people in their family, then everybody in their family is instantly a close contact and could be out spreading it around, right?
Exactly. We see an increased infectious period in those early days. So day 3 to 7 are maybe some of the worst spreading. And then after that, the infectiousness seems to be decreasing. So that's the reason for the change in the days. I think that change has caused some confusion. We just want to be very clear that the quarantine is a 10-day ask. Mm-hmm. The next thing is for positive cases. If somebody is identified as a positive, they're asked to isolate away from others. Isolation is the term that we use for people that are sick and have tested positive. Isolation means that they stay home, keep away from household members as much as possible, and after those 10 days, if they are not having any symptoms, then they are also done with their isolation period.
Okay.
So 10 days is a pretty decent number for individuals to remember if they're confused. I get a lot of questions regarding the travel and what the expectations are for people that have traveled outside of Cordova and return. Right now, according to the state, these are best practice recommendations. The ask is that people get a test 72 hours prior to coming to Cordova, and then they strict social distance until they get a second test, and the second test should be obtained between 5 to 14 days after. The strict social distance is defined as people can be in outdoor public spaces, but they should remain 6 feet away from anyone not in their household. They should wear a face covering. They should arrange for curbside pickup for food or groceries or any shopping they do. And they're asked to not enter into bars, restaurants, gyms, community centers, office buildings, and to not participate in group activities, sporting events, weddings, funerals, or other gatherings. So all three of those, the quarantine or isolate or strict social distance, are all somewhat similar requirements. It causes a little bit of confusion, and hopefully this can help clarify for people a little bit.
Okay, good. Well, and the interesting thing too is that we have seen, with our current round of cases being sparked apparently by an out-of-state travel situation, and that one that we had a little while back that, as I recall, was associated with a social gathering. The premise for this guidance seems to be well-founded, as we have seen in our community, because it's been times we've kind of let our guard down in these specific cases, social gathering and traveling, that we've had the most trouble. So it seems like it stands to reason that we should be able to continue to be successful as we have in these other periods if we follow some of those things. Did I hear you had something to add in there?
Yeah, I agree. I think sometimes we've been so successful that it feels like, I think it's easy to become fatigued with some of these measures and not feel and not recognize how important they are. And I think we're seeing just how important they are, and that those practices have helped us keep our normal operations over the last year. It's somewhat normal.
Is there any way to know if we're going to, I would hope at some point we're going to get to a point where an increased number of folks that are vaccinated is going to begin to impact some of these numbers. Is it still a little early to tell when or if that's going to be the case?
I think Alaska and Cordova are moving toward those numbers, and that amount of vaccine being available that we can achieve herd immunity. I think we're getting there quickly. We're really looking forward to our vaccine allocations for March. Our first allocation is going to come the first week of March, and we will be holding a vaccine clinic on March 10th. We're currently going through our list, making sure that we identify anybody that is eligible. You can check to see if you're eligible for vaccine on the state's website. We are asking everybody to sign up regardless of vaccine eligibility. They can find the sign up on our website or by calling 424-3045. And we expect the state to open up the next tier for vaccine and increase eligibility for individuals sometime in mid-March. So we're really looking forward to opening up those tiers. Currently, we have enough vaccine to get through all eligible individuals for March with the current tiers.
Well, and let's differentiate, too, because you mentioned the state website. The state also has places to sign up for vaccine, but Cordova's got one that is a little better tailored to our needs, and it's our database, as I understand it, that's going to result in callbacks for appointments. Is that right? So signing up for what the state offers, is that really kind of pointless for Cordovans, or is it an important step?
No, we want Cordovans to only sign up on our local database.
Okay.
We do not have access to the state database, and they do not provide us that information.
Okay. So people are hearing things about signing up with the state, and that the state will then somehow get them an appointment, but that doesn't work for us. The best and as I understand it, only way to get a Cordova appointment is to communicate, as you said, through the local asset on the CCMC website or by calling that phone number that you mentioned.
Yes.
Okay. So what's next, I guess, in managing this outbreak that we have? Has most of the contact tracing been done, or is that still underway, and can we expect more?
I think the contact tracing is still underway. The public health nurse is still working to identify and reach contacts. Some people will only be receiving a letter from the schools that was written under the guidance of the Department of Health and public health nurse. So for some people, that letter might be the only contact that they get, asking them to quarantine because they were in an environment with a positive case. Because this is a large number of contacts, we are opening up. CCMC is collaborating with Alonca and will be offering a large testing availability on Monday morning. So Monday, we're asking all student contacts to come. If your last name starts with A to E, you should come to the parking lot at the hospital at 9 a.m. for testing. We will have the last names F to L come at 9:30 and M to Z come at 10 o'clock. We will be opening up for community testing for community members that feel they were a close contact at 10:30. So we will be posting these times on websites as well as sending out that information. But we do want anybody that's a close contact to come on Monday for testing.
Okay. Yeah. If you can be sure that we get a copy of that too, then we'll push it real hard as well. And I want to thank you again for taking the time to visit with us. It's not like doctors aren't busy enough just being doctors, being on the radio a whole bunch too. So thank you. It's I mean, again, a tough situation, but delightful to have you in the information loop so we can really get this information firsthand. We hope you have a good and safe weekend.
You too. Thank you.
All right. Thank you to Dr. Sanders and Mayor Koplin for joining us on today's program. Again, not a particularly brief briefing, but we hope you found it informative. And of course, as things continue to unfold, both from the city standpoint and the medical standpoint, we will continue to bring you that information. COVID-19.cityofcordova.net continues to be a good asset for you to get information from the city. That's the official City of Cordova website on the response. And here on KLAM and KCDV, we'll utilize the 1, 5, and 8 p.m. hours weekdays for our briefings. Plus, you can see any of our past ones going all the way back to the beginning of this if you like. YouTube.com/Cordova TV, and this one will go up there as soon as we can get it uploaded. Thank you for joining us. Again, be safe, follow those protocols, and hopefully we can get this thing contained and get ourselves back down to zero where I know we like to be.